So as in my previous video where I had explained about the bottom surgeries from a female to male transition, now we'll talk about bottom surgeries for a male to female surgical transition where the male genitals are converted into a female genitals. Now for these also surgeries, the main important thing is independent psychiatrist evaluation and certification, and preferably on endocrine therapy. Now, the important thing in a male to female surgical transition is the vaginoplasty, where the vagina is created. There are different techniques, different types of these surgeries, is all for the lining of the vaginal cavity. There is one that is penile inversion. In this, what happens is the penis muscle and everything is removed, and the entire penile skin is inverted into and kept inside the vagina, which is created, and lined it. So this is one of the most, it's kind of a gold standard and routinely done in many centers. But here in what happens, it gives a little unnatural looks because it looks like a skin which is going interned inside the vaginal cavity. And of course, it is a very dry, as well as you will not have any natural lubrication. So, and of course, the depth and the length of it is a little restricted depending on the size of your penis which is available. Then coming to that, next is the intestinal vaginoplasty. Now in this intestinal vaginoplasty is a part of the intestine with the help of a GI surgeon, and laparoscopically we use a part of the intestine to line the vaginal cavity. This can either be a sigmoid vaginoplasty, or it can be ileal vaginoplasty, or a jejunal vaginoplasty, depending on the intestine which we are taking to line the vaginal cavity. Now again in this, yes, you have the depth is quite good, the length is also good, you have a lubrication, but yes, of course, there might be sometimes a little offensive smell or some fecal matter smell might be there because of the per se lining of the mucosa of the intestine which we have used. Then the third thing is the peritoneal pull-through vaginoplasty. Now, peritoneal pull-through vaginoplasty is the one where the peritoneum is used to line the vaginal cavity. Now, what is peritoneum? Peritoneum is nothing but it is the internal lining of the entire abdominal wall, and that is dissected again with the help of a GI surgeon and a laparoscopic surgeon. We take the mobilize the entire peritoneal lining from inside the abdomen, and we bring it down, which is called a pull-through. We bring it down into the vaginal cavity which is created and used to line the entire vaginal cavity. Now in this again, what happens is one, you get a natural lubrications, that is of the peritoneal fluid which is kind of liberated out, it kind of lines the vaginal cavity. Second thing, it gives a little natural appearance because the mucosa forms and it grows on top of that. So it gives a little natural appearance to it. So these are the various types of vaginoplasty depending on the lining what we are using. So if you want to know anything more in details about these procedures, or you have any queries regarding these procedures, you can write in the comment box. One, above all things you have to maintain is the proper hygiene after any of these procedures. Plus, along with that, you have to have a frequent dilatations and frequent follow-up with your primary surgeon to get a good results. Thank you.